Welcome, everyone. Thank you for joining us today. Salient Medical Solutions is pleased to have been asked to host this global webinar for SStar Medical to introduce the latest developments in autologous regenerative medicine with volumizing PRP gel in Canada called Cellenis NaturaGel PRP. My name is Jay Herman. I'm the president of Salient Medical Solutions. We have been the Canadian partner for SStar Medical since 2016 and the introduction of Cellenis PRP into Canada. SStar Medical is a world leader in platelet-rich plasma and autologous regenerative therapy, constantly driving advancements in the pursuit of clinical excellence. We're very pleased to welcome today the medical director of SStar, Dr. Sary, to talk about these latest advancements in autologous regenerative medicine. Welcome, Dr. Sary.
Thank you very much, Jay. And thank you to Salient Medical for organizing this international webinar for SStar Medical. I am very excited about the opportunity to connect with professionals worldwide and share insights into this innovative technology. Please note that some of the treatments and products uses I will discuss may be considered off-label in some countries. So let's start. So today we're going to talk about the Cellenis NaturaGel PRP. What is this? This is a natural injectable PRP gel that provides best of both worlds, the volumization and regeneration. Let me introduce myself. I am Dr. Sary Kada. I am a general practitioner and surgeon with emphasis in general surgery. I'm certified in aesthetics medicine and certified professional in platelet-rich plasma therapies and dermal fillers. I have an extensive experience in facial rejuvenation and hair restoration using autogenous modalities. And over 9 years, I've been dedicating and focusing on exclusively on the PRP, platelet-rich plasma. And I've been studying, researching, and developing new protocols to now share with you what I've learned. So what is Cellenis NaturaGel PRP? Cellenis NaturaGel PRP is a regenerative therapy that provides volume. It's 100% natural injectable material that creates an immediate volumizing effect that lasts. Builds on proven efficacy of Cellenis PRP, allowing for longer lasting tissue regeneration. This unique process that converts the patient's own blood into a gel-like substance provides support to the dermal infrastructure to volumize the face and body. As I said before, it is a completely autologous product that is derived from the patient's blood with a minimal to no risk immune reactions. What are the indications for Cellenis NaturaGel PRP? So it can be used in every area since it's autologous, it's coming from the patient's own plasma. So it could be used everywhere in the face and in the body. And it's ideal for difficult to feel areas such as tear trough, lip lines, and large volume areas like abdominal areas or décolleté or also gluteal augmentation. So we have Cellenis in around 60 countries around the world. And we have a different brand name for Cellenis Natura Gel PRP. So we have Cellenis Derma Filler, which is our global brand. We have Canada, the Cellenis NaturaGel PRP, Cellenis Derma PRP in the States, and Cellenis Biofiller in the United Arab Emirates. So let's learn a little bit about the mechanism. So first of all, it all starts with platelet-rich plasma. What is platelet-rich plasma? Platelet-rich plasma, it's a high concentration of platelets in a small volume of plasma. The minimum concentration to call it platelet-rich plasma is 2 times the baseline compared to the baseline of the whole blood. So the goal here is to move the highest possible percentage of platelets into the plasma while removing the undesirable components of the whole blood that won't be helpful for the regenerative process. And so we start first with the Cellenis PRP technology. That is our base to create the method of Cellenis NaturaGel PRP. So let's learn about the importance of having a technology supporting this method. First of all, we need to understand the healing cascade. So in the healing cascade, we have two phases. We have the inflammatory phase and we have the resolution phase. In the natural scenario, we have that the inflammatory phase is longer or it takes longer in time compared to the resolution phase. But if we want to regenerate the skin, if we want to rejuvenate, we want the inflammatory phase to be shorter and to extend the resolution phase. And how we do that? So we need to understand the biologic processes that take place to do this. The first process is the platelet activation. So what is PRP? As I said before, PRP is a high concentration of platelets. And so when we have a natural wound, the first cell fragments or the first blood components that are coming into the place are the platelets. So we start or we mimic that process by injecting that high amount of platelets. And then those platelets will signal to start the healing. And the second thing we need is are the neutrophils that in the natural wound they migrate to the wound to fight bacteria or any other microorganism. But we do not need here this neutrophil migration because neutrophils are pro-inflammatory and we want to shorten the inflammatory phase. So what we do with our Cellenis technology is to remove up to 96% of the neutrophils. So we do not have that inflammatory process taking place. And then a second important activity that should happen in order to skip that inflammatory phase is to differentiate the monocytes. So we have monocytes that can differentiate into macrophages type 1 and macrophages type 2. In a regular situation, we will have immediately macrophages type 1, and those will stay in tissue to damage that tissue and to damage bacteria. And so we don't need that. We want them to become macrophages type 2, and so they help with the tissue regeneration. And how we do that? So I will explain you in the coming slide the specific process, but for now I can tell that by removing those neutrophils and removing the red blood cells, we can make those monocytes to become macrophages type 2. And so then we can go to the resolution phase, where we get the angiogenesis, or new creation of new vessels, activation and recruitment of tissue progenitors, and tissue regeneration, which is what we are aiming. When we choose a PRP system, we need to ask ourselves 4 important questions. So it depends if we want an uncontrolled catabolic process or a controlled anabolic regeneration. So those 4 questions are: what is the platelet concentration? What is the level of red blood cell contamination? What is the leukocyte concentration? And is it user-friendly or is it very difficult to use? So let's go one by one. First, let's talk about the platelet concentration. So we have 2 sizes of tubes in here. We are working with an 11 ml tube and with a 22 ml tube. From an 11 ml tube, we can achieve around 2.5 billion platelets per dose. And from the 22 ml tube, we can achieve double. And regarding the concentration, there are many studies like this one here that, for example, this one here is showing endothelial human cells exposed to different platelet concentrations. And we can see in that study that the percentage of motility and the percentage of invasion of those endothelial human cells is triggered by a certain concentration between 0.3 million to 1.5 million platelets per microliter. So from several studies like this one, we know in the PRP world that there is a number of platelets that is considered the gold standard platelet concentration, and that is 1 million platelets per microliter. Here in the first image, we can see the percentage of motility. And the first peak is 0.3 million platelets per microliter. So the second peak is the 1.5 million platelets per microliter. So here we are talking about millions. And it doesn't matter if you centrifuge your sample and you collect all the plasma, right, to inject, you will be around this peak. In the first one, the 0.3 million platelets per microliter. But if you want to concentrate that plasma, and if you remove 2/3 of this upper fraction, you will have around 1 million platelets per microliter, which is the gold standard. But it doesn't matter what you do, you will always be in the regenerative range for regeneration. So that's one of the advantages of Cellenis PRP systems, that you will always have a regenerative platelet concentration. Very important. This is the same study showing the morphology of those endothelial human cells exposed to those different platelet concentrations. And so to summarize, we can see that the morphology and the proliferation of those cells is optimal when we are around 1.5 million platelets per microliter, and that it's good when we have around 0.3 million platelets per microliter. And when we are creating the Cellenis NaturaGel PRP, we are around 0.3 million platelets per microliter. So we will be in the regenerative range. And these graphics here show that after 72 hours, those human cells exposed to, this is the black line, the black column is the control. And then we have the second line, that is 0.3 million platelets per microliter. And then we have the highest column, that is 1.5 million platelets per microliter. And then we have the last, the fourth column, that it's very interesting here because it shows that if we are over 5 million platelets per microliter, it has an inhibitory effect. So always we should stay between 0.3 and 1.5 million platelets per microliter. And that's what we will do when creating Cellenis NaturaGel PRP. Let's talk about the red blood cells. So red blood cells are very sensitive cells. They get damaged easily. And when we are centrifuging those cells, and when we are even doing the blood draw, those cells, the membrane of those cells get damaged, and they start releasing their content. And one of those components that are going to be released is the hemoglobin-3, and that is a very cytotoxic substance that triggers a profound pro-inflammatory process and stops the regeneration process. So it is very important to remove the red blood cells from a PRP sample. If we are going to inject it back to the patient, we need to remove those red blood cells. And here I brought different studies showing how toxic are red blood cells to other cells, to mesenchymal stem cells, to cartilage cells, for example, to skin cells as well. So again, very important to remove the red blood cells. And with the Cellenis system, we can remove 100% of those red blood cells. So we don't have to worry about this issue. Here you can see the activities that take place when we have red blood cells contaminating a PRP sample. So we have radical oxygen reactions, oxidative stress, local vasoconstriction, inflammatory processes, impaired cell metabolism, tissue damage, inflammatory infiltrate, We have endothelial cell dysfunction, vascular damage, more eryptosis. We have mesenchymal stem cell dysfunction. And all of those are exactly the opposite from what we want to achieve, which is an anti-inflammatory microenvironment that heals the tissue and accelerate the healing process. So again, and I repeat this, we need to remove red blood cells from any PRP sample. If we don't do that, we will have suboptimal results, and we cannot see those results in our patients. Regarding white blood cells, we have two main cells. We have the monocytes and we have the neutrophils. So as I said before, neutrophils are 100% pro-inflammatory cells. They only cause inflammation. So we need to remove those neutrophils. And with the Cellenis system, you can remove up to 96% of those neutrophils. And in this table here, that is comparing different systems in the market, we see that this first two, that is Eclipse and Tropocells, which is the same as Cellenis, just different brand names again. We have between 0 and 4.3% of neutrophils. And the other systems have from 6% to even 48%. So we have the lowest percentage of neutrophils in our PRP samples. And that is why Cellenis is so renowned and so effective. Regarding the monocytes, those are cells that can be good or bad. They can be pro-inflammatory or they can be anti-inflammatory. So in order to change them and to make them be anti-inflammatory, there is a process that we need to follow. In order to make a monocyte become an anti-inflammatory cell, we need to first remove neutrophils. And so when we remove neutrophils, we have those macrophages type 1 turning into reparative macrophages type 2. So this is the first step, remove neutrophils. And this is what we're doing. We're removing neutrophils. And second, we need to surround those monocytes with anti-inflammatory signals. So what happens here? If we have a PRP sample with monocytes that are surrounded by red blood cells and also neutrophils, we will have pro-inflammatory signals around them. So they will tend to become macrophages type 1, which is the inflammatory phenotype. But if we remove those red blood cells and we remove those neutrophils and we surround them only by platelets, which is Cellenis case, those monocytes will differentiate into macrophages phenotype 2, which are proliferative. They help with the proliferation and healing process. So this is what happens in our PRP samples. We are turning those macrophages into anti-inflammatory cells. So at the end, all our PRP will be anti-inflammatory, and we will trigger the reparative process and make those results visible. So that was everything about cells. Let's talk about the PRP systems in the market. So most of the PRP systems in the market are buffy coat based. That means that after the centrifugation process, we will have a very thin line, very thin layer that will contain all of the platelets. It will contain all of the white cells, including the neutrophils and monocytes. But it will also contain some of the red blood cells. And this is the buffy coat is what you want to collect to inject to the patient. So imagine having a sample of PRP, a tube with the blood, and separate the blood components, and having this thin line that you need to collect and then inject. If you try to collect that buffy coat with a needle, for sure you won't be able to collect only the buffy coat. You will collect the buffy coat plus some plasma plus some red blood cells. So your sample will be contaminated with red blood cells, a huge amount of red blood cells, and you would have all of the neutrophils in your sample, meaning that around 70% of your white blood cells in your PRP sample will be neutrophils. It's a very high pro-inflammatory substance. You won't have results with this. You could have some results, but those results won't be optimal. And this is when we have patients that are not satisfied with their results. And so some scientists came out with a solution for this problem. So they said, okay, so what if we spin the sample very slow so that coffee coat will be suspended in the whole plasma column? So we can just collect the whole plasma and inject it. So we won't have our sample contaminated with red blood cells. The problem is that, yes, you can do that, but the problem is that you won't be able to concentrate the platelets, and you won't be able to separate the white blood cells. So again, unless you centrifuge the sample a second time, you won't be able to have a specific cell characterization in your PRP. You will have a full column of plasma with all of the white cells, including neutrophils, and with platelets and with monocytes, but you won't be able to concentrate unless you spin it twice. So we came out with a different solution, a solution for all of those problems, which was to insert a separation gel. So when we insert that separation gel in the tube, we can actually separate the monocytes from the neutrophils. So as you can see, after the centrifugation process, you get 3 layers. You get the full plasma column, followed by the separation gel, and in the bottom of the tube, red blood cells and neutrophils. On top of the gel, you will get all of the platelets and monocytes. And the rest of the plasma column, it's completely, there are no cells in there. It's acellular. So why we want this? And this is very important to take in consideration, because when we are creating the Cellenis NaturaGel PRP, we want to collect a fraction of this plasma that is acellular, and we want to heat it. And when we heat it, we are not destroying any cells. So we are not causing any inflammatory processes, which can happen if you try to do this method with other PRP system. I will explain you this better later. So this is how it looks like. So you have a column of plasma, which is acellular, or maybe it has an insignificant amount of cells. And then you have this darker area here that contains all of the platelets, and then the rest of the components that we don't want in our system, in our PRP. So first of all, our tubes have that separation gel that helps us having the exact components that we want to have. It's vacuum filled, so the blood draw is very easy. You just connect the tube to the holder and the butterfly needle. You collect the blood. The blood will stop when the vacuum is finished. So you can just disconnect or detach the tube, and it will be ready to centrifuge. And it's also our Cellenis tube are also internally coated. So why? Because platelets are cell fragments that are made to attach to surfaces, and they also attach to the tube walls. So what we want to do is to avoid that. So we are inserting a coat in the internal walls to avoid platelets from sticking to the tube walls. And so we are not losing platelets while collecting our plasma. Then we also have an anticoagulant, which is already pre-inserted, and that anticoagulant is modified to have physiological pH. So that helps to the cells to survive or to be functional for a longer time, and also it reduces the burning sensation while injecting the PRP, because every anticoagulant in the market is acidic. It's pH 4.5 to 5, so it affects negatively the cells, and also it burns when it's injected. So we are helping with that too. And of course, our Cellenis system is completely a closed system, so there is no risk of contamination, of bacterial contamination. Okay, so now let's focus on the Cellenis NaturaGel PRP system. So what we do, what is the process about? So first of all, we take the plated poor plasma, which is separated from the plated rich plasma. So after the centrifugation process, we just take the tube in an upright position and we extract the PPP, the upper fraction of the plasma. And the second step is taking that PPP and expose it to very high temperatures. We are talking about 100 degrees Celsius. Where what are we doing here? We are taking all the plasmatic proteins that are in the plasma. 60% of them is albumin, and we are denaturizing those proteins. So we are turning a liquid plasma to a gel-like plasma. That is what is going to give us the volumizing effect. That gel stays in tissue from 4 to 6 months. So the volume in our patient will last from 4 to 6 months. And of course, since we are mixing that PPP after the heating process, we are mixing that PPP, that gel-like scaffold, with the PRP. So then we have a filler that releases growth factors and triggers the regeneration process. So what we have? In summary, we have a patient that comes to the procedure and goes with an immediate result that is immediately visible, because you are volumizing with the gel-like structure coming from the PPP. And when after 3 months, after 3 weeks, that the platelets, the healing process start showing the results, the patient can really see how the skin texture is changing and improving. So we have both. We have a volume and skin texture improvement. So here, this is it's just a picture of how the process is. So first of all, we have the plasmatic proteins in their native state, where the hydrophobic domains are inside the protein, so they are not exposed to the outside. Then when we expose those proteins to high temperatures, they unfold and they expose those hydrophobic domains. And as you know, when we expose hydrophobic domains, those domains tend to attach to each other immediately. So what we have here is a protein mesh that we will mix with platelets, and we will trap those platelets into that mesh. So again, we have a protein structure which is thick and dense that releases growth factor. This is an electron microscopic image of the gel. Okay, so let's see the video, how to process the sample. Here we have the tube containing the after centrifugation, just the blood. We centrifuge it for 10 minutes at 1500 G. And then this is what we get. We get the tube with the 3 layers, right? Then we connect the vented needle, which is this one here, to balance the pressure Why? Because we don't want those places to be resuspended before time. So we insert this to let air enter into the tube, so we are not causing turbulence while collecting the plasma. And then we attach a sharp needle, a long needle, to a filter and the syringe to collect the plasma. So what we do is that we collect the upper fraction and we insert it in the heating device. Now, if you are using an 11 ml tube, you will need to collect 4.5 to 5 mLs of plated pore plasma, the upper plasma fraction. And if you're using a 22 ml tube, you will have to collect between 9 to 10 mLs of plated pore plasma. Then you just remove the air from the syringe completely. And if you have foam, also remove the foam. And then close it with the tip cap, with the red tip cap that comes in the kit. After 10 minutes of a heating process, you can see that the texture and the color of the liquid changed and it becomes solid. So then you attach a connector to the syringe and the PRP that you collected from the same tube, and then you just mix it. Then when it's ready, when the mixture is homogeneous and you cannot see big particles, you can transfer it to 1 ml syringes. This is very important because then you can have control of the injection and the amount of NaturaGel PRP that you are injecting. And as you can see in the video, this is how it looks like. It can be compared to a medium density HA. So there is some information that is important to know. First of all, the product can be injected up to 4 hours after the blood is drawn. And to inject it, it's recommended to use 21 to 25 gauge needle or a 22 to 25 gauge cannula. Personally, I prefer to use always a 22 gauge cannula for the injections. This is how I reduce the extraction force, so it's easy to inject it, and also I prevent blockage of my cannulas. Most injections are performed subdermally, and that is how it provides a very natural results. And so the way we inject it depends, of course, on which areas we are injecting. So we are using pads. Primarily, we use linear retrograde threading, cross-hatching, or interrupted threading techniques. This interrupted threading technique, we use it for the tear trough area, injecting a very, very small amount of the NaturaGel PRP. And this should be followed by massage. Every time we inject, we follow the injection by massage for even distribution of the product. So regarding literature, we have several publications in the general literature about this technique, about heating the plasmatic proteins and inject that for volumization. So I won't go deep into these studies, but you can see that the results are very natural, and patients are satisfied with the results. Also, that it can be used for different indications. For example, this study is talking about facial volume restoration, full facial volume restoration. So in this other study, this is about this technique for nasolabial false wrinkles. Safety is also an important think about having these studies, because we can realize that this technique is very safe. This is for full faces also. If you want these studies, we can share these after the webinar. You can request them. Another indication is atrophic acne scars. So let's see the results with our Cellenis NaturaGel PRP. This is the early impact. So here we wanted to show a patient that is allergic to HA. So she got Cellenis NaturaGel PRP injections with no adverse effects. This is before the injection, so you can see the tear trough and the nasolabial folds and marionette lines. So this is just 1 week post injections. So you can see that the results are very visible and very natural, and that there are no adverse effects, there is no puffy look. And this is 2 weeks post injections, so we can still see even more regeneration, and the volume is still there. This is a patient, this is a picture immediately after the injection, just to show that it acts as a medium density HA, so it has a strong power of for volumization. So we are just treating here a cheek defect, and for this patient it lasts for around 4 months, and then we have the skin quality improvement. As I said before, one of the most popular indications is the tear trough. So there are some patients that they cannot get HA because we will have migration of the product and it will look worse than the baseline. So this is the right product to use in these cases. And by injecting a very small amount. Here we have another patient. As I said before, the tear trough is one of the most popular indications for Cellenis NaturaGel PRP. And by injecting very little amounts of the product in an interrupted threading technique, we can achieve these kind of results. So we inject a little bit of product, we massage, we inject a little bit, we massage, and like that we can get these results. Sometimes we have patients where they are not candidates for fillers, since the anatomical problem is not right for fillers. So what we do is using this product instead. So we won't have any migration. We will have a very good spreading of the product in the tissues and get very natural and beautiful results. Here we have the same patient. You can see also her jawline was treated, and she had a cheek augmentation to support the tear trough. Here another patient. Here we can see a chin augmentation and marionette lines. This is immediately after. Another patient. This is only 2 hours post-treatment. What we want to show here is that there is no downtime. So, and this is a full face. What we expect is only a heat sensation and also redness after the treatment. It will disappear in around 2 hours. This is another tear trough. You can see very, very beautiful results. Same patient here. Another full face. This is an abdominal rejuvenation. This is around 3 months after one procedure. We used here 24 mLs of NaturaGel PRP, coming from 222 mLs of blood, or 222 mLs tubes. Here we have a neck rejuvenation. This is one of the most responsive indications for NaturaGel PRP. By treating the submandibular and the submalar areas only, and a fanning technique with an opening incision or an opening entry from the submalar area. From submental, sorry. Some gluteal augmentation and cellulite treatment. So you can see here, this is after the treatment. Very beautiful and natural results. And let's see what are the results after 3 months. One of my favorite patients here, you can see the tear troughs are obviously great. We had an obvious and great change. She got also a full face treatment, not only the tear troughs. And if you can see here, it's not only the volumization and the tear trough correction, but also the skin quality improved greatly after the treatment. This is another patient with the same results. You can not only see the beautiful correction of the defects like the tear trough, the nasolabial and marionette lines, but also you can see how the skin quality improves. Again, you can see the tear trough volumization, but the skin, it's amazing. And this is not makeup. It's brighter, it's shiny, it's hydrated, and this is the results. These are the results you can get with Cellenis NaturaGel PRP. It's another patient. So this patient, we did something different with her. We under-corrected the defects. So we injected only very small amounts of the product to see the reparative effects of the Cellenis NaturaGel PRP. What we found out is that the reparative effects are great after 3 months. So you can see the tear trough here and the periorbital lines with under correction, but they are very, very improved. Again, the same patient. This is soon a close-up of the perioral lines after 3 months. This is the same patient from the beginning. The third picture is after 2 months, and the fourth picture is after 3 months. Again, look at the skin quality improvement, not only the volumization. In this patient, we treated the tear troughs. So the first picture is before the first treatment. The second picture is before the second treatment, meaning 3 months after the first. And the third picture is immediately after the second treatment for full correction. The same patient, so this is our most popular protocol. We treat the patient, and then after 3 months, we do a second session to correct, and that lasts for a year. Now let's go with the common questions. So let's start with which areas of the body can be injected with Cellenis NaturaGel PRP. So you can inject any body area and any face area with NaturaGel PRP because it is natural, it is autologous, and it does not cause any adverse effects. Second, which injection technique should be used to inject Cellenis NaturaGel PRP? So the injection technique you should use is, first of all, by injecting in the subcutaneous layer. We want to keep a safe depth to avoid lumps, and also depends on which area you are going to treat. So if you're going to treat the tear troughs, as I said before, you can use a interrupted threading technique. If you're going to do cheek augmentation, you can do by threading techniques, linear, or by boluses. And in general, a linear threading technique is the most used one. Always followed by massage. In what tissue layer should Cellenis NaturaGel be placed? So again, in the subdermal layer. It also could be injected in the supraosteal layer, or you can multi-layer. You can inject in both places at the same time to get more volumization, more projection, and also skin quality improvement. How much time do I need to let it cool down after the heating process? So you should let it cool down after the heating process for around 10 minutes if you put it in the freezer, or 5 minutes if you put it in cold water. So the process is like this. So first of all, we centrifuge the blood, we collect the PPP, we heat the PPP, and we cool it down. We cool it down or in the freezer or in cold water. In cold water is faster, so you can do it for 5 minutes. I just make sure that the tip cap is well attached and it's secured, and then I just put it in a bag and into the water. Then I take it out, I clean it, I dry the syringe if I didn't use a bag, so I dry the syringe, and then I clean it with any disinfectant, medical grade, and then it's ready to be mixed with the PRP. Why we need to do this? Because we need to take it down to body temperature, because we're gonna mix it with platelets, so we don't want to destroy those platelets. We want it to be cold and to keep the platelet functionality. How much time do I have to inject Cellenis NaturaGel PRP after preparation? So you can use the product after 4 hours from the blood draw, but I always recommend that if you're not going to inject immediately the product, leave the PPP in one syringe and the PRP in the second syringe, and only mix those right before the injections. Why? Because we have two phases here. We have the liquid phase, which is the PRP, and we have the solid phase, which is the PPP. So if we let it sit for more than 15 minutes or even 10 minutes, the two phases will separate, and then we will have our cannula blocked. So always just mix it before the injections. Which cannula or needle size is recommended for Cellenis NaturaGel PRP placement? So a 22 gauge cannula or a 21 gauge needle. If you're going to treat the tear troughs, so you can still use a 25 gauge cannula, but make sure that you mix very well the PRP with the PPP, so you won't have any blockage of the cannula. How much product should be injected per area? So again, since we have a liquid phase that will be absorbed in the first 24 hours, we want to overcorrect. I always like to start with the 100% correction, and after 100% correction, when I get more experience with the product, so then I start injecting 20 to 30% more. Why? Because we will lose around 30% of the original volume that we inject, which is the liquid fraction. Can the final product be made less thick? Yes, you can make the product less thick by simply collecting more PRP and less PPP. So you will be hitting less PPP, and you will have more of the liquid fraction. So your product will be less thick. The thing you have to take in consideration here is that the more liquid fraction you use, the less it's gonna last in the tissue, because it will be absorbed faster. And I always recommend to stick to the original protocol. If you have a 11 ml tube, just collect 4.5 ml to 5 ml of PPP. This is what you're gonna hit. Or if you're using a 22 ml tube, collect 9 to 10 ml of PPP, and this is what you're going to hit. This is really giving very good results in every area that you could use it. Is there any antidote in case something goes wrong during the treatment? So first of all, it is very, very difficult that something goes wrong with Cellenis NaturaGel PRP. It doesn't matter even if you inject a lot of product in just one area. With a strong massage, you can spread it and you won't have any unnatural results. But let's say that you did something very, very bad and you need to dissolve it. So what you do is you take saline, you inject saline directly into the place where the product is. So you are adding more liquid of the liquid fraction, and then it will be easier to spread in tissue and it will be absorbed fast. Massage is the first treatment for any if something goes wrong, and the second is injecting saline. In case of vascular occlusion, if we're going to talk about vascular occlusion, so the risk of vascular occlusion with Cellenis NaturaGel PRP is very, very low. Why? Because it behaves very different than HA. If we have HA exposed to water, it would absorb water, and if we have it perivascular or intravascular, it can cause the vascular occlusion. But the Cellenis NaturaGel PRP behaves different. If you expose Cellenis NaturaGel PRP to water, it will separate in very small fragments. So you can just, by injecting saline, you can spread it, you can separate the particles and massage, and it will be moved from the vessel. In case you inject it intravascular, so it's the same. Since it's gonna have contact with the blood flow, it's gonna be separated in very small particles, in very small fragments, and it won't cause any vascular occlusion symptoms. In case you have after injection any vascular occlusion symptoms, just massage the area very strong, and it will disappear. What is the difference between Cellenis NaturaGel PRP and injectable IPRF? So the so-called injectable PRF is just PRP without any anticoagulant. So what you're getting there, it's by centrifuging or by spinning this blood sample very slowly in a very short time, you will get some platelets separated from the blood in a plasma fraction. You will get most of the white blood cells, including the neutrophils, in the sample. And from 10 ml of blood, you will get around 1.5 ml of injectable PRF, which is completely contaminated with red blood cells and completely contaminated with neutrophils, and it has very low platelet concentration. So you're basically injecting a very low quality product that, yes, it volumizes because the fibrinogen that is in the PRP will turn into fibrin, and then you can get a clot, and that will volumize. The thing is that clot, the body knows how to metabolize that clot in maximum 10 days. So the volumization will be lost in maximum 10 days. The average it's 5 days, and there is a study showing the difference between these two products. So here is the study. In the first image, they are comparing the PRF clot with the heated PPP scaffold. So they found out that only after 24 hours, the PRF clot maintained only 23% of its original volume. That means that more than 80% of the volumization will be lost in the first 24 hours. And then in the second line, you can see the heated protein scaffold. And after 24 hours, it maintained 96% of its original volume. That is only around 4% of the liquid fraction that is being absorbed or being lost. And in the second image, you can see the protein scaffold exposed to very high enzyme concentrations, the same enzymes that will metabolize it in our bodies. And after 14 days, the scaffold or the protein filler reduces its size to 13 to 14% of its original weight, or its original size. So that means that this technique will last in tissue for the first months, and then we will still have the regenerative effect of platelets. So with only one treatment, we get from 3 to 6 months of volumization, and then when the volume disappears, we can still see the skin quality improvement for up to 10 months. And if we do 2 treatments separated by 3 months, we can achieve the volumization for more than 9 months and skin quality improvement for more than a year and a half. Thank you very much for your attention. And if you have any questions, you can send them over, and you can always contact me to solve any type of doubts that you can have. Thank you very much.